My name is Erin Roach, and my presentation is on hospitals. Our learning objectives today are understanding hospitals, Americans' hospital origins, motives for establishing hospitals, types of hospitals, hospitals' organization and structure, financial challenges and insurance, financial conditions of hospitals, technology impact on hospitals, and effects of ACA on future hospitals. Understanding hospitals. They are a place for treatment of the sick and the injured. They also function as research labs and are an educational institution and a major employer within the community. Hospitals are undergoing vast changes regarding their way of operation, but despite the changes, the characteristics that they have remain intact. There's changes in ownership, structure, financing, and their relationships with other physicians, healthcare providers, and their communities. Hospitals are looked at as the center point in regards to the changes required by the ACA. American hospital origins. They were first found to shelter older Americans, the dying, orphans, and vagrants, also to protect residents of a community from the contagiously sick and dangerously mentally ill. During the 18th century, most of the medical care was provided in the homes. As the population began to increase in places such like Boston and in New York and other seaport towns, it was necessary to start providing the ill victims with the care that they needed. The townspeople responded by organizing pest houses, quarantine stations, and isolation hospitals in order to segregate the sick people from the town people to prevent the spread of disease. During the 19th century, hospitals were dirty, unventilated, and contaminated with many infections. They were overcrowded and offered little to no medical care. Only nurses that worked there were women who couldn't get work or former prison inmates. Conditions of the hospital were very unknown by the public because there was restricted visiting and patients were basically cut off from the outside world. During 1850, the Protestant nursing movement was brought from Germany to Pennsylvania, and it was based on formal training of nurses. It had an important influence on nursing today. Civil War of 1860s brought public appreciation to the work of women in nursing. Nurses tended to sick and injured soldiers after returning to their hometowns. This was the first time that many soldiers encountered with women as nurses outside of the home. Nursing gained a lot more of a positive image and was viewed as a more respectable career option for women. Motives for establishing hospitals. Hospital care reflected the American concept of charity and public responsibility. It required provisions be made for the low-income population and people with mental or physical illness. Later on, physicians realized the efficiency of separating the sick population from the rest of the needy and put them in facilities more properly called hospitals. Hospitals provided a place to practice surgery and obstetrics, centrally locating patients to serve their instruction of medical students, while also protecting the well population from people with physical or mental illnesses. Types of hospitals. There's acute care hospitals, which the average length of stay for patients is less than 30 days. There's teaching hospitals, which are affiliated with medical schools and provide clinical education for medical students. Most teaching hospitals are voluntary, not-for-profit institutions. A more recent survey conducted by the AHA concluded there were 2,903 voluntary not-for-profit hospitals. There are non-teaching hospitals. There are public hospitals, which have services that include trauma centers, psychiatric emergency services, alcohol detoxification services, other substance abuse treatment, and burn treatment. There are investor-owned for-profit hospitals that grew from a few physician-owned facilities, and most for-profit hospitals belong to one of the large hospital management companies that dominate the for-profit hospital network. Usually, their services are limited to one of the three categories being orthopedics, surgery, and cardiology. Lastly, there's specialty hospitals, which treat less complex, more profitable cases, leaving the more difficult and less profitable or uninsured patients to be served by community hospitals. Hospital organization and structure. This description is based on a not-for-profit community hospital. The hospital is divided into 3 different entities: the medical staff, the administration, and the board of directors or trustees. The areas of the hospital functions have the usual units of medical, nursing, patient therapy, diagnosis, fiscal human resources, hotel services, and community relations, which all represent the major operating divisions. Financial challenges and insurance. Hospitals transition from charitable institutions to complex technical organizations accompanied by the parallel growth of private hospital insurance. During the 1940s, only 9% of the U.S. population had hospital insurance. During the 1960s, billions of dollars flowed into hospitals from insurance companies. Availability of hospital insurance removed an important cost constraint from hospital charges. In 1966, there was a passage of Medicare which provided Americans over 65 years of age with significant hospital and medical benefits. Medicaid, established around the same time as Medicare, supports medical and hospital care for persons classified as medically deprived. Medicare had enormous impacts on hospitalization rates in the U.S. and did more to fuel the rising cost of hospital care. After these programs, hospitals became increasingly focused on profit and reduced services that operated at a loss of cost. Financial conditions of hospitals. The Balanced Budget Act of 1977 reduced payments for Medicare patients below the cost of treating them, creating havoc on U.S. hospitals. Costly new technology, pharmaceuticals, and services were rising at an extreme pace. The ACA published a survey in 2000 that 90% of the responding hospitals reported serious financial problems that required cost-cutting measures, and many had to reduce the staff. Also, there's specialty hospitals competing with community hospitals for their most profitable services, added to the continuing loss of community hospitals. Technology impacts on hospitals. Hospitals primarily motivated to adopt new health information technology to lower costs and to reduce medical errors. Technology has allowed hospitals to reduce information duplications and improve the utilization of laboratory and radiology results. There's also an increase in efficiency of coding and billing. Healthcare personnel is provided with quicker access to patient records. AHA survey about adopted health information technology, specifically electronic health records, found that capability more than doubled from 16% to 35% between 2009 and 2011. Effects of the ACA on future hospitals. According to the New York Times article, Affordable Care Act reduces costs for hospitals, reports say. Hospitals will reap benefits financially and gain more paying customers once states broaden eligibility. States that have already expanded with this have seen substantial reductions in uncompensated care with fewer uninsured patients. Sylvia Matthews Burwell, the Secretary of Health and Human Services, says that because of ACA, we project that hospitals will save $5.7 billion in uncompensated care costs this year. Uncompensated care is the total amount of unpaid bills and charity care provided to low-income patients. Financial reports have been showing that Medicaid expansion has reduced the number of patients that cannot pay their bills. These are my references.